U.S. Senator Ed Markey paid a visit to Worcester today. Among his stops was UMass Memorial. Olivia Lemmon spoke with Senator Markey about his efforts to lower the cost of health care. She's here now with more details. Olivia?
Kayla, Senator Markey says UMass Memorial Healthcare makes a large contribution to the Worcester economy. He says today the need to continue federal funding for research that is done at the school is important. Some of that research looks at ways to lower the cost of health care.
There's no question that no one wants to retreat from the goal which we have: universal access to health care and making it affordable.
U.S. Senator Ed Markey visits UMass Memorial Healthcare Wednesday to talk about managing the overall cost of healthcare for patients. Markey says the Affordable Care Act has had huge success in providing healthcare services to those who need it.
We had first to meet the goal of making sure everyone had health insurance, everyone had access to care, and now we have to continue to focus on how we can lower the cost of insurance so that people have an ability to afford that care.
Accountable care organizations take large healthcare systems like ourselves and really encourage us to try to connect all of that care for the patient, coordinate the care so that the patient ends up with better health, and we see improved quality of care and a reduction in total medical expenditures.
UMass Memorial CEO Dr. Eric Dixon says the cost of healthcare in the United States is rising quickly. He says it's almost 20% of the gross national product.
That's an important driver of the economy in our region, is to be able to offer healthcare at a lower cost than other regions, and that's what's going to make us more competitive in the marketplace for the businesses that are trying to make their product or sell their service from the region.
Dixon says UMass serves about 130,000 patients through their hospitals and primary care facilities.
Those would include both Medicare beneficiaries, Medicaid beneficiaries, and those that are commercially insured, for, typically a working population and their families.
Dixon says research at UMass Medical School could help. He says it focuses on better and more cost-effective ways to care for patients.
This is an engine of economic growth, providing high-quality healthcare services to this entire region.
Now, Dixon says focusing on how they manage the care of patients who use emergency department services often or visit their doctors a lot will be important when looking at how to make health care more cost-effective. Kayla, back to you.
Thanks, Olivia.